Welcome to the online CME for Pediatric Headache. My name is Ed Smith, and I'm the co-director of the Boston Children's Cerebrovascular Surgery and Intervention Center.
One of the things that's on the schedule for this discussion is to try to figure out some way of identifying headaches that are worrisome. Covering every single type of headache is a huge topic and beyond the scope of what could be done in the half hour here or perhaps even with several hours. So the goal will be to focus on identifying headaches that may be associated with surgical lesions, to try to identify some causes of symptoms that may be worrisome, to go over a little bit about what to do with imaging and referral once a headache is identified as being worrisome, and then to talk about some of the more common neurosurgical headaches such as hemorrhage, Chiari, and hydrocephalus, which are really sort of the big three. By way of background, one of the questions that comes up is, how common are headaches in kids? And surprisingly, although maybe not that surprising to those that see kids on a routine basis, they really are quite common. Up to a third of kids will complain of weekly headaches, according to one study from about a decade or so ago. Why do kids get headaches? Well, the definition of headache really sort of outlines two different types of headache. There's a primary headache, which is defined as a migraine or a tension type, and cluster headaches. And then the ones we're more concerned about are the symptomatic headaches, which are caused as a symptom of some sort of underlying process. And the real job, I think, that all of us have to do as pediatricians, nurse practitioners, neurosurgeon, is identifying which are the dangerous ones. So, we've talked about this, I think, in the past, and one of the issues is that pediatricians have a very difficult job. They have a kid that comes in with a headache, and there's a million different causes. We as neurosurgeons have it easy because we get a scan with showing what the problem is already. And working together, I think one of the things we can try to answer, what causes headaches in kids. The most common causes of headaches in the pediatric patient, the common ones are migraines, tension headaches, and post-traumatic or post-concussive headaches. This is about 70% of all pediatric headaches, with the rest really mixed in between sinusitis, dental issues, systemic illness, psychiatric-related, and hypertension. Speaking just briefly about some of the more common ones, migraine, for example, really can be very common, especially in younger kids, and maybe present in boys, despite what's thought about to be present in more commonly in teenage girls. I think the ones we get worried about are the symptomatic ones. These are less common but more concerning. Headaches from mass lesions like tumors or vascular malformations, headaches from ischemia like you might see in moyamoya, pseudotumor, thrombosis of blood vessels, infection within the brain, meningitis or empyema, hemorrhage within the brain, Chiari malformations, and then hydrocephalus.